Welcome back to the Todd Ortloff Show here on KONP Radio. I'm Amanda Bacon, filling in for Todd Ortloff today and tomorrow, as his daughter gets married.
Aww.
So I know he still owes me big though. We are going to switch gears. Last segment, we were talking about plants and all of the things with the master gardeners who we always appreciate having come in. And this segment, we're actually going to be talking about something fairly serious, but something that really needs to be chatted about. And open dialogue, I think, is the really big issue here, because I think there's a lot of stigma around what we're going to talk about. And we're going to work at tearing all of that away, which we can't do in 20 minutes, but we can work on. So I've got 3 guests in studio with me today. I have Allison Berry, our health officer for Clallam and Jefferson counties. I've got Stephanie Akin, the R.E.A.L project manager from Reflections Counseling Service Group. Is it Akin or Akin?
Akin.
Oh, yes, I was right. And Brian Gerdes. Gerdes. Shoot. I knew I was going to screw something up. Community Paramedic and Port Angeles Fire Department. Welcome. So nice to have all of you in here. Brian, you're a tall drink of water, so I'm going to have you move that mic just a little bit closer to you, since we were a lot shorter group in here before you. So, all right. So let's talk about this. International Overdose Awareness Day is observed annually on August 31st. And Port Angeles actually has I'm going to say celebration, because I want it to feel that way, I think. Celebration that's going to be happening that day. So, Dr. Berry, do you want to talk about that first?
Sure. And actually, I think probably Stephanie would be the best one to speak about what we're going to be putting on that day.
Hi. So on August 31st, communities around the world will observe International Overdose Awareness Day. It's a time to honor the lives we've lost, support families and friends who've grieved, and recommit ourselves to saving lives. For me, this day is really deeply personal, not just as someone who works in the recovery, but as someone who has lived it. We are going to be down at the pier in Port Angeles, Washington from 6 to 8 p.m., where we're going to be having really just raffles, and we're going to have snacks, and we're going to have some grief support groups. And I think we have 12 agencies that are going to come and join us on that day. We're going to do the bell ringing of those we've lost, and we're going to do a family tree. Our theme this year is One Big Family.
Oh, wow. So for a family tree, what do you mean by that?
So we are taking a big board and we are creating a tree, and we're going to take paper leaves, and we're going to have people write the names of their loved ones and themselves, and we're going to put it on kind of like a remembrance wall. So we're hoping to get a lot of people to add to it to show that we are all in this together.
That is a fantastic idea. And I think, I'm going to actually go to the paramedic in the room for this next part of it, because you guys are the ones that are first on scene, usually, if 911 has been called because of an overdose. And so I think you see this a lot more firsthand than the rest of us. I know that it's something that we hear a lot, but I understand that the overdose rate is actually down a little bit in Clallam County from where it's been.
Significantly, I think.
Yeah,
absolutely.
Yeah.
I think over the last year, it's dropped about 33%.
Yeah, we used to have, unfortunately, the highest overdose death rate in the state, and we're down to
Clallam County did?
Clallam County, just a few years ago, and we're down to the 12th highest. So still, still a big issue, still a lot more to do. But I think it's really been the combination of all of these different groups working together: the fire department, the recovery community, the health department, law enforcement, all kind of working together to see where we can move the dial to save lives in our community.
Where do you think the disconnect is for people who haven't dealt with or lived with somebody who deals with addiction and might find themselves in an overdose situation? Where do you think the disconnect is, that they think that maybe that's not something that they should worry about? Or why are we working so hard to fix that problem? Why do you guys have Narcan? What are we doing to solve it instead of just Band-Aid it?
Well, I think the most difficult part for people to understand is addiction is unlike anything else. It's alcohol and other substances are something that it's the layperson can't fathom, can't understand. So as far as disconnects and what we see, most people just see a bunch of ambulances and fire trucks and stuff showing up. They think that there's been a much greater incident, but usually we arrive to find somebody who is conscious and that we're speaking with. And the disconnect is thinking that these people are experiencing something that they've chosen, and instead we should be looking at it like it's a medical problem. Or
yeah, I think that's a really common misconception is people think addiction is a choice. And if you know someone in your life who's struggling with this level of addiction, you know no one would choose that.
No.
And I think people don't understand that chronic use of opiates really rewires your brain entirely, to the point that you really can't feel good feelings like joy or comfort without access to those opiates when you've been using it long enough. One of the most common misconceptions I hear is that people think people are using to get high. And the vast majority of people who are using are just using not to feel terrible. They're just trying to not feel withdrawals. They haven't gotten high in years, but now their body is hooked and they don't know what to do to fix it. And that's where people like us come in, is to try to get them that help they need.
Is there a statistic at all of people who either try something for the first time and it's laced with something and it kills them, or people that might find something that they don't realize, like children finding, something? Is that ever into the mix of statistics? Does that count as an overdose death in the area?
Yes. So anyone who dies with opiates in their system and reason to believe that the overdose was the primary driver is counted. And so in the last year in Clallam County, we lost 25 of our citizens to overdose deaths. And that's just a fraction of the number of overdoses that are out there, because thankfully there's all this good work getting naloxone into the community. And so not everybody who overdoses dies, but that's 25 families who are forever changed by what happened there. And that includes everybody. That includes when we see, unfortunately, kids get a hold of something they didn't know what they were getting. We had very sadly deaths of a couple kids in our community in the last few years, who, kids put stuff in their mouths. Yeah. They don't know what they're doing. But mostly that's folks who are actively using, who didn't mean to overdose. They didn't mean to take so much, but the drug supply is unregulated. So you don't really know exactly how much you're getting when you use.
So Stephanie, talk about your role in all of this and counseling with people and helping them figure out maybe a different path for them to walk down that they might want to.
So to start, I am a person in recovery of 5.5 years now.
God bless. Congratulations.
Thank you. So I have faced some really dark times, including 7 overdoses that could have ended my life. I'm grateful every day that I survived those moments and that I get to sit here today and share about this. So I run a peer recovery navigator program out of Reflections Counseling Services Group. So we're really walking next to an individual, trying to navigate the systems, trying to navigate what next steps are, what their goals are. Being a person that has come from something that they're closely experiencing, it's almost like a comfort. One, they get to see that it is possible to find recovery. And number two, I can relate. Right. So being able to have that relation, they're more open-minded to talking about the services and hopefully gaining recovery. I mean, that's the ultimate goal, is that we help them gain that recovery and whatever it looks like.
I think it's incredibly rewarding work, getting to work with people who are legitimately trying to get back on track, get on a track. Maybe they don't have family. I forget that I'm kind of a freak, because I have so much family here and we're always all up in each other's business. And that's how I grew up. So I feel like that's how everyone is, that's normal. But there's a lot of people that don't have family to check in on them or to take care of them or to worry about them. And I think it is just so incredible that we have such an incredible network of people in this area that do worry and care about those that are maybe less than cared about by others.
Absolutely. I think it's a common gap, as you mentioned before, is that people don't realize that not everybody has the lives that we have. I live inside. I get to go home to a safe place every day with people who love me. And that's not true of everybody in our community. And so having someone who shows up and says, I still care about you no matter what's going on in your life, and I'm here to walk this path with you, makes a huge difference.
Or to just go find them.
Yeah.
Like, we don't know where they are.
Right.
Yeah.
A lot of times until there's a 911 call. So, to be able to see, that's kind of the first time you see that person. And then without the connection that we have with other agencies in the community, no one else would know about them. So, pushing them on to, making sure that they have a pathway to the next part of their care plan or whatever is really important. That's what these guys do.
So real quick before we have to go, this big event that we're talking about is Sunday, August 31st, and it is a family friendly and free event. So we want to make sure that people know that children can come and are encouraged to come. And there's going to be all sorts of different resources there, but there's also going to be some snacks and some fun things. And, I think it's a great way for the community to come together and remember, observe, honor, celebrate, like Stephanie. I hope everyone throws a parade in your honor, Stephanie. And I think it's a great time for all of us to come together.
Yeah, and break down that stigma. For many, many years, if you lost someone to an overdose, many people didn't feel like they could talk about it, and they had to suffer in silence. And so part of what we're trying to do is normalize that this has happened to a lot of families in our community. And it's that silence that keeps it going. But if we talk about it, if we work on it together, we can really move towards a more positive answer for more folks.
I think this is great. Is there a place where people can go and get more information about this work, this event?
Yes. So North Olympic Healthcare has it on their social media, on their website. I think a lot of the agencies are posting it. There is flyers almost in every downtown building, restaurant, and antique shops down there. There's been or you can go down to their local office downtown, or their one up across from Fast Burrito, and also grab a flyer.
And Clallam County Health Department will be there offering resources, naloxone education and distribution. And we also post to our social media, so you should be seeing more on the internet about it. We'd love to see y'all come out.
Allison, Stephanie, and Brian, thank you so much for your time today. I think this is an incredible event that you guys are supporting and putting on. And I really hope that everyone shows up and supports our community and the ones that are marginalized and really, really need our support. Thank you so much.
Thank you.
All right, that's going to put a wrap on it for the TO show. We hope you have a wonderful rest of the day. We will check back in with you right after the news.